this is Princey, Associate Professor in Mental Health Nursing. When a client comes to a psychiatric OPD, he consults a psychiatrist, and the psychiatrist finds out that he is having the symptoms of sadness, worthlessness, helplessness. The psychiatrist may diagnose the condition as having the depression. So, the first mode of treatment for a client with depression, the psychiatrist will put him on the group of drugs known as the antidepressant drugs. Yes, the topic for discussion here is the antidepressants. So, what are these antidepressants? Antidepressants are a group of drugs which are used in the treatment of depressive conditions. These drugs are otherwise called as the mood elevators, which are going to elevate the mood of the patient since the patient's mood is low, or otherwise they are called as thymoleptics. So how is this antidepressants came to be known, right? So what is the bit of history behind this? So in the earlier days, when the people were treated for the tuberculosis, they were given this major group of a drug which is known as isoniazid. Isoniazid is one of those drugs, which is given for the treatment of tuberculosis. A derivative of isoniazid, which is the iproniazid, was used for the client, which is having the action of the MAOs, which is monoamino oxidase inhibitors. Right, so these drugs, when they were administering to a patient with the TB, they had a lot of anxiety and fear, and they also had a lot of stress which made them to feel very depressed, because in the earlier days tuberculosis was one of those conditions which were causing the fatality, right? So they used to become very depressed since the treatment options weren't available. So this drug, when it was administered to the patient, they found that the moods of such patients were improved, right? So the elevation was there in the mood. So that is how they found in the year 1958 that isoniazid, or the group of drugs which are having MAO properties, right, monoamino oxidase inhibitor properties, can be used for treating the mood of the patient who feels very low, so who are very depressed. So that is how these antidepressants were discovered. These antidepressants are not having any kind of a euphoric activity or a euphoric state when it is administered in the patients who are normal or who are not depressed, right? So it is not going to cause that kind of elevation in the mood which is going to cause a euphoria or a manic condition. No, these are just going to control the mood, or mildly going to elevate the mood of the patient. Let us see the indications of the antidepressant group of drug. As the name says, it's widely used in the treatment of depressions. We have got various types of the depression. So it can be the major depression or endogenous depression episode with the melancholia, who are receiving or weren't receiving any kind of electroconvulsive therapy. Depression with the psychotic features, there may be a schizoaffective disorder, may depressive type. So in those conditions also antidepressants can be given along with the antipsychotic drugs or along with the ECTs. Another condition that is used is the dysthymia, reactive depression, depression equivalence, or the masked depression, atypical depression, secondary depression. Because of any other medical disorders, the patient is having the depression secondary to the medical disorder. In those cases also antidepressants can be administered. Abnormal grief reaction. So these are the conditions or the various types of depressions where the antidepressant group of drugs are preferred. If you see the childhood psychiatric disorder, there are certain conditions wherein the children are very fearful or become very anxious. Okay, they are not able to control. So in those cases, the antidepressants also are used. So those conditions are the enuresis, ADHD, school phobia, separation anxiety disorders, somnambulism, that is the sleepwalking and the night terrors. The other psychiatric disorders wherein antidepressants are used are, in case of panic attacks, the social phobia, agoraphobia, OCD with or without any kind of a depression, cataplexy, aggression in case of the elderly people, eating disorders, borderline personality disorders, trichotillomania, depersonalization disorder, post traumatic stress disorder, generalized anxiety disorders, nicotine dependence, alcohol dependence. So, these are the other psychotic disorders wherein the antidepressants can be administered if there are symptoms of the depressions which are noted. Right? So, this is about the indication. Moving on to the classification of the antidepressant drugs. So, we have got the major classifications. We have the first generation antidepressants and the second generation antidepressants. The first generation antidepressants includes the TCS, that is the tricyclic antidepressants, as well as the monoamino oxidase inhibitors, MAOs. These group of drugs are going to bring about some effects in the various neurotransmitters. The second generation antidepressants, which includes the SSRIs, that is the selective serotonin reuptake inhibitors, NSRIs. Okay, so these groups of drugs are having fewer side effects compared to the first generation antidepressants. So let us see the further classification of the antidepressants. So first group of classification, we have the cyclic antidepressants. So in the cyclic antidepressants, the classifications are as follows. The first one is the tricyclic tertiary amines. The examples are amitriptyline. The next one is a tricyclic secondary amines, which includes the examples of nortriptyline and desipramine. The third group is the tetracyclic antidepressants, example amoxicillin. The next one is a bicyclic antidepressants. Classification that we have as selective serotonin reuptake inhibitors. The example we have got the fluoxetine. Serotonin norepinephrine reuptake inhibitors, example venlafaxine. The next classification is norepinephrine serotonin reuptake enhancers, example tinaptin. The next one is noradrenergic and specific serotogenic antagonists, example mirtazapine. The next one is norepinephrine dopamine reuptake inhibitors, example is bupropion. The next one is serotonin antagonist reuptake inhibitors, example trazodone. The next classification is noradrenergic reuptake inhibitors, example we have is reboxetine. The last classification is the MAOIs, that is monoamino oxidase inhibitors. So that is the classification of the antidepressant drugs. Okay, moving on to the pharmacokinetics. The oral dose of TCAs, that is tricyclic antidepressants, are rapidly absorbed by the GI tract and they are going to cause some anticholinergic effects in the client, like delay in gastric emptying as well as slowing down the gastric motility. The SSRI group of drugs are rapidly absorbed from the GI tract. They are highly lipophilic and highly protein bound. So these are rapidly distributed and they are accumulated in the areas where there is a lot of blood supply. The half-life is usually very long. It's usually more than 24 hours. So how does the metabolism happen? The metabolism of TCAs happen by oxidation followed by the conjugation. These kinds of antidepressants, especially the SSRIs, are going to cause some enzyme activity, that is inhibition of cytochrome, which is an enzyme which is present in the liver. The MAO group of drugs are rapidly absorbed from the GI tract and they are metabolized by a process called as the acetylation. So that is about the pharmacokinetics. Moving on to the mechanism of action. So each group of drug is acting in a different way in terms of bringing about change in the neurotransmitters. So let us see the mechanism of action. The exact mechanism is unknown, but it is found that when these antidepressants are administered, it is going to bring about a change in the catecholamine levels, right? That is the serotonin levels and the norepinephrine level. There are going to be some changes. The TCAs, which is also known as monoamine reuptake inhibitors, act by blocking the reuptake of the norepinephrine as well as the serotonin, which is the 5-HT, at the nerve terminals, thereby increasing the level of the norepinephrine and serotonin at the postsynaptic receptors. So, thereby you understand that the level of the serotonin and norepinephrine is elevated. So, in depression, what happens? There is a change in the neurotransmitter, that is decrease in the serotonin level in norepinephrine. So, when we give this antidepressant drug, so at the receptor side is going to have an increase in the level of the norepinephrine and the serotonin by having the effect or the action of reducing the reuptake of these catecholamines. So what happens? The brain level of these catecholamines are elevated, thereby they will elevate the mood of the client. If you want to know when the depressive symptoms will come down, so if you take the MAO group of drugs, it takes about 5 to 10 days for the symptoms of depression to come down. And if you take the TCA group of drugs, it takes about 2 to 3 weeks for the depressive symptoms to come down. So it depends on the type of the antidepressant group of drugs which is administered to the client. So if you take the SSRI group of drugs, the mechanism of action, it is going to, reduce or inhibit the reuptake of the serotonin at the receptor site, thereby increasing the level of serotonin at the receptor site. So that is about the various group of antidepressants, how the mechanism of action happens at the neurotransmitter level. So moving on to the adverse effect of the antidepressants and the nurse's responsibility. So number one, we have got the adverse effect which will happen related to all the classes of the antidepressants. Number one is the dry mouth. So what happens here in the dry mouth, since the patient is on antidepressants, you have to see to it that the oral hygiene of the patient is frequently done. The sips of water can be given to the patient. The use of ice and lemon can be given to the client. So that is the management for the dry mouth. The next one is the sedation. So if the patient is having more sedative effect, see to it that the medication is administered at the bedtime. So the prescription of these drugs, sedative drugs, should be usually done by psychiatrists at the bedtime to avoid this dizziness which happens during the daytime. And also during the daytime, we encourage the client not to use and to avoid the use of any kind of machinery equipments driving, because it can cause the injury to the client. The next one is the nausea. So how to handle nausea is you encourage the client to take the drug with the food, okay, so that it will avoid the GI irritation. The next problem is the blurred vision. So blurred vision can happen when the patient is on the therapy. Reassure them that no, the blurred vision can be reversed, once the therapy has been completed, and also educate them not to drive or not to use any machineries or any equipments when they are having this blurred vision because of risk of injury. Another problem the patient can experience is the constipation. So see to it that the client includes the high fiber diet and encourage the physical activity and exercises, and also the fluid intake to avoid the constipation. The next problem is the urinary retention. So urinary retention can be managed by encouraging the client to visit the toilet frequently and maintain the intake output chart, and see to it that you use the various stimulation for the urination methods, right? Like running water in the bathroom or pouring the water onto the perineal area. So such kind of methods can be used to promote the excretion of the urine. The next problem is the orthostatic hypotension, very important when the patient is on the antidepressant group of drugs. We educate them not to immediately rise up and walk from the sleeping position. Educate them to slowly sit down from the sleeping position and then to stand and start their activity, and also monitor the blood pressure of the patient. If there are variations in the blood pressure, we have to bring it to the notice of the physician. There may be chances of reduction in the seizure activity or the threshold, so always see to it to find out if the patient is having the history of seizure, and also monitor if the patient develops any kind of seizure activity. There may be problems with the changes in the heart rate, tachycardia, arrhythmias can be there, so always monitor the pulse rate, monitor the cardiac activity and the rhythm. Problems with the photosensitivity can be noted, so educate them to use the sunscreens or the use of goggles or the clothing before they move out to the sun. The next problem is the weight gain. So most of the patients, they may be at risk of gaining the weight. So educate them to have a balance in the calorie intake and also do the exercises frequently and also monitor the weight of the client. So what are the adverse effects which happens because of the SSRIs? We have got the insomnia or the agitation. So how to manage this insomnia or agitation? See to it the patient doesn't sleep during the day and doesn't take such kind of a medication during the night, right? So it should be taken during the day because of the risk of insomnia. Teach the relaxation techniques to the client so that it will promote his sleep, and also educate them to avoid caffeinated drinks or the food which are going to stimulate the uh, brain of the patient, thereby resulting in insomnia. The next problem is the headache. So, administer the analgesics as prescribed also by the physician. So, educate the client to always inform the physician if related to the medical problem or any other problem, to inform the physician that he is on this particular antidepressant group of the drugs. There may be problem with the weight loss when the patient is on SSRI. So, monitor the weight of the patient, preferably on the same scale every day. Encourage the caloric intake of the nutritious diet so that he may not lose the weight. There may be problem with the sexual functions, so sexual dysfunctions can be there. Educate them to communicate or to report if they have the abnormal ejaculation or impotence. Women may experience delay in the orgasm or the loss of the orgasm. If the side effect becomes very intolerable, they can communicate to the psychiatrist so that they can change the antidepressant drug. So that is about the various adverse effects of the antidepressants. Moving on to the nurse's responsibilities when she's administering the antidepressant drug. The first thing, you have to assess the client's level of the severity of the depression. So how severe is the depression of the client? So also see to it that what are the adverse effects of the particular drug. Okay, what may be the adverse effect? Monitor for the behavioral change of the client, the drug interactions that can happen, and the therapeutic effect, how effective that particular drug is. So you are going to monitor that. So the therapeutic effect of the antidepressant usually takes place by 2 to 3 weeks. So is after 2 to 3 weeks, you wait for about 4 to 8 weeks for the therapeutic effect to be seen. So still there is no any improvement in the symptoms. You may have to meet the psychiatrist for the change of the antidepressant agent. Assess for the side effects like abdominal distensions, which indicate there is a urinary retention problem, and the constipation. Assess for the vital signs. The patient may have the risk of changes in the cardiac system rhythm, tachycardia, and also closely monitor the cardiac status. Monitor for the signs of seizure activity. You can give the drug with the food to avoid the GI upset or the irritation. Monitor the liver for the liver function test, since it is going to cause some kind of a drug interaction with the liver. Okay, when it is metabolized in the liver. Also, see to it that you monitor the WBC level as well as the blood glucose level to see to it if there are any changes which can cause the problems in the patient. So, that is the nurse's responsibility. Moving on to the patient and family education when the patient is on the antidepressants. When the patient is on the tricyclic therapy, see to it the following is being educated to the client. First thing, you have to educate them to make sure the drug is taken at the right time as it is prescribed. Okay, no, not to make any changes in the dose, not to make any changes in the frequency without the intimation to the psychiatrist. And also educate them that the therapeutic effect can be seen only after 2 to 3 weeks. They can wait up to 4 to 8 weeks for the symptoms changes that can be seen in their symptoms. Then later on they can approach for if there are no improvement in the symptoms. Educate them not to use any kind of over-the-counter medications for cold remedies which can have a drug interaction with the antidepressant group of drugs. If the patient is having any other medical conditions or any surgeries to be done or any problems related to the dental, see to it that that they inform the particular professional that they are on the antidepressant group of drugs, because it can result in the drug interaction. Educate the client and the family to report any changes in their health in relation to the fever or malaise, throat infections, urinary retention, which can give a clue that they are having a problem with the changes in the WBC count. And the important thing that you have to educate is to avoid the excessive activity and high temperature because of the risk of the respiration. Educate them that a lot of doubts that the family may have, that these psychiatric drugs are going to cause a dependence. So educate them that these drugs are not going to cause any kind of a dependence, but it will be given for a longer duration of time if the symptoms are not going to improve, since there may be deficiencies in the neurotransmitters. Because of it, the drug therapy can be continued for a longer period of time. Educate them to avoid the diazepam drug as well as the alcohol, since it is going to cause some interactions with the absorption of the antidepressant drugs. So these are the educations that you will be giving to the patient as well as the family related to the antidepressant drugs. Okay, so very important, these antidepressant drugs which are going to bring about an improvement in the neurotransmitter serotonin by bringing about the change at the receptor sites, wherein the symptoms of the patients will be improvised, right? So the see to it that the patient and the family doesn't hurry to note the improvement in the symptoms. It takes its own time. Educate and reassure them that the symptoms will be treated, but only thing you have to give a dedication and the compliance to the drug regimen. Hope you all have understood the topic.